Good afternoon, everyone. Welcome to the University of California, Los Angeles Center for Health Policy Research, California Health Interview Survey, CHIS Data User Training Webinar. This training webinar will have a focus on the new CHIS 2022 data that was just released earlier this month. My name is Jacob Rosalez. I am the CHIS Data Dissemination Manager. We'll begin with the CHIS overview and then a demonstration of the AskCHIS query system, the AskCHIS Neighborhood Edition system, and our CHIS health profile. At the end of this webinar, we will have a Q&A session. It'll be moderated by Tiffany Lopes. So brief overview of the California Health Interview Survey, also known as CHIS. It is the nation's largest health survey. It's one of the most comprehensive sources of health information in the state of California. It's a very comprehensive range, robust range of topics that we go over. You see bullet points here, run from health status, mental health, oral health, health behaviors, employment, other sociodemographic, health insurance, and other respondent characteristics. CHIS is a collaborative project funded by federal and state health agencies in California and national foundations and others. Looking at the structure of the CHIS survey, these are all survey interviews. It's a mixed method now. We do surveys via telephone as well as on the internet. This covers adults ages 18 and older in households, adolescents ages 12 to 17 if present, and then also children ages 0 to 11 if present. With the child sample, that is done proxy by their parents. So it's not really surveyed of the children. The questions are asked to the parents, and the parents ask on behalf of the children. Whereas the adolescents, those ages 12 through 17, those teens that get permission from the parents are given the survey. This is conducted in multiple languages: English, Spanish, Chinese, Korean, Vietnamese, and Tagalog. CHIS methods that reflect California's diversity. We have targeting sampling methods. Like I said before, a multi-mode data collection. We provide the survey in multiple languages. We also do custom oversampling, especially for areas like San Diego County and Los Angeles County, where we oversample for in LA County, it's the service planning areas, and in San Diego County, it is the Health and Human Services District. And then we also do follow-on studies where appropriate. Additions for CHIS 2022. For adults, we have questions based on whether their experience with hate incidents, and then also a COVID-19 vaccination status and sources of news information. For adolescents and children in 2022, we have COVID-19 vaccination status. All these are available in the public use files. We refer to those as PUF, and also in AskCHIS. So now we're going to go to look at AskCHIS first. Pull that up. And you'll notice here, this is our new and improved revamped Center for Health Policy Research webpage. If you're on our CHPR webpage, you can access AskCHIS and AskCHIS Neighborhood Edition. Also, I'll be referring to AskCHIS Neighborhood Edition as AskCHIS NE. On this top toolbar up here, quick link. You can select AskCHIS Neighborhood Edition. There's also other ways. You could go search, or you can go into our work section and look at the California Health Interview Survey. Pop up here, and that'll take you there. But the quickest way from our webpage would be this quick links option, AskCHIS NE. Also, if you don't even want to go to the CHPR webpage, you can just do a quick Google search. If you just Google search AskCHIS, it's all algorithm based, so it kind of depends on your searching. But for me, I've gotten my Google now where if I just type in AskCHIS to Google, it's the very first link. So there's a multiple ways of accessing AskCHIS. So let's go into the AskCHIS platform. Log in. Our landing page is going to ask you to select a geographic area. By default, it automatically just selects search all of California, and you'll see in the geographic area that it just says state. But you also have the option to search for individual counties or specific regions. We have the different counties listed here. So we have Northern Sierra counties all listed here. Now you'll notice there are 3 different counties that really aren't counties. They're an aggregate of different counties. They're like a cluster. So you have like Tulum, Calaveras, Amador, Inyo, Maricopa, Mono, and Alpine, all grouped into one county, into one region. Del Norte, Siskiyou, Lassen, Trinity, Modoc, Plumas, and Sierra there, and another one. And then I believe, Tehama, Glen, and Calusa. But other than that, other than those those are more like rural northern counties. All the counties you're going to get estimates for all the individual counties. Now you notice we have these tabs here for Los Angeles County Service Planning Areas, SPAs. Because we do an oversample of those, we have direct estimates for each one of the SPAs in LA County. And then in San Diego County, we have the health regions, and we also have estimates provided for there. Before we move on and look at topics, I just want to point out with the AskCHIS, with this platform here, you are getting direct survey estimates. These are weighted, these are direct estimates from the survey data. There's a little bit of difference between the estimates that you're going to get in AskCHIS Neighborhood Edition. I'll discuss that more, but for the purposes of AskCHIS, these are direct survey estimates. So right now in this demo, I'm just going to just keep it as all of California. I'm going to move on and select topic. You're going to see here that we have a myriad of different categories: health status, COVID-19, health conditions, not cancer, discrimination, health behaviors, etc., etc. If we were to select health status, I can see that I can pull from like general health. And I'll just select health status. You get information on this specific variable, tells you the years that it's provided, the different age groups that are included, and the categories: excellent, very good, good, fair, and poor. You also get a drop down for more information, and it gives you information on each one of the years for the variable, letting you know the variable source, what the respondents were asked, and other notes. To generate my table, I'm just going to select Get Data. My estimate table gets run for the year 2022. For each variable, it's going to run the estimate at the most recent year that it came in. So for this variable, it's 2022. Some variables, they may have ended because of the funding got dropped, or we just dropped the variable, and it may end at 2020. So you do have to keep an eye on those variables to see what years. If you want to select more years of this variable, you go up to the years section. Maybe I want to do a comparison of all of this decade. So 2020, 2021, and 2022. I run my Get Data. And now it's going to load an estimate table showing me estimates for these 3 years. Now you may find some of the variables, some of the estimates have, they may have a red asterisk that indicates that there's instability. And if that's the case, you may want to pool the years of data together. So if I go back to here, I have a compare, and then I have a pool. If I pull my data together, I will get a pooled estimate of these 3 years. And this is a weighted estimate of the survey data. I'm going to remove the pooling and just focus on 2022. But now I'm going to run a cross tabulation. So I'm going to go to compare topic. I'm going to cross tabulate this by demographic. I want to look at race and ethnicity. I'm going to select the race OMB/Department of Finance. You'll see here that this one includes Latino. So we have Latino, white non-Latino, Black African American non-Latino, American Indian, Alaska Native non-Latino, et cetera, non-Latino. Run my get data. And you'll see here, we have some instability in these estimates. And this pop-up will give you, they'll say you might want to pull the years, collapse topics, etc. Just for the purpose of this demo, I'm going to select don't show me the warning again in the session. And you see here, I get a red asterisk and saying that's indicating that my estimate here for Native Hawaiian Pacific Islanders is unstable. We identify instability in AskCHIS as those estimates that have a coefficient of variation that are greater than or equal to 30%. So there's multiple things that you can do to account for the instability. You could pool the data, which I already showed you all, or you could go to adjust layout and you could collapse the topic. So maybe I want to collapse fair and poor together, excellent, very good, and good. So essentially, I'm going to change this from a 5-level variable to a binary variable, collapsing excellent, very good, and good together, and then fair and poor together. You see, we still have the issue of instability here for the Native Hawaiian Pacific Islander, and this usually has to do with regards to the size of the sample for each group. So one thing we can do here is we could go to pooling. I've already showed you pooling. Another thing that you can do is adjust the layout. I went over collapse a topic, but we can also collapse our compare topic. We can collapse race and ethnicity. So if you wanted to, you could combine Native Hawaiian Pacific Islander with 2 or more races. Now, I know some people might say, like, these are unique groups, and this might not be the wisest thing to do for research purposes. And I actually agree with that, but I'm just kind of showing you that this is one option that you might want to consider. It would probably be maybe a little bit more appropriate with something other than race and ethnicity, but just for the purposes of this demonstration, I just wanted to show you how to collapse the compare topic. And again, now we see that we have instability is no longer an issue here. I'm just going to reset these levels, go back to how it was. Now we see we do have the instability. So let's just pull this data. I'm going to pull 5 years of data because sometimes especially with some of these race ethnic groups, sometimes you need multiple years of data to pool. And because this variable is running from 2001 all the way to 2022, we have a lot of data to work with. Make sure that I select that pool button, get my data. And usually the more data that you have in there, the more the system is running through all the different data files. It might take a little bit longer to have it run. And now we see that we no longer have any issues with instability for the Native Hawaiian Pacific Islander. Pooling. I'm also going to remove the compare topic by race. You can generate a bar chart or a pie chart. And then you also have the option to do trending. For any variable that has 3 or more years in it, you can trend the results. And this will generate a line graph showing estimates for every year. You can email yourself results, or you can export them. In the export button, we also have a limit population feature. So maybe you're interested in the older population. So maybe you're looking at folks that are over retirement age. So you could limit the population by age, essentially filtering by age. So let's just select 65. So it's going to say limit population of those 65 and older. I can limit by gender, male or female. I can also limit by just a specific race ethnic group. And for this option, it's just looking at the OMB Department of Finance race that we already went over with the compare topic, as well as we have a federal poverty level. So I'm going to look at 65 and older at a federal poverty level of let's say 109 below 200. Run the data. And so now we're seeing that in 2022 in California, for adults 65 and older that were under 200% federal poverty level, 38, about close to 39% had fair or poor health. Move the limit population. I'm going to go back to the compare topic. Look at health insurance, current coverage, if they're currently insured. I'm going to generate this table. I'm going to go to adjust layout, and I have the option to transpose the topic. So essentially, this is going to flip. This is going to flip the data table around. I go to transpose topic. The topic was originally health status, but it gets flipped over to being currently insured, and the compare topics are the health status. So going back to topic selection, you see here that we have the categories, but we also have a search functionality, this search tab over here. And so you can search if you're looking for gun violence or food insecurity. If you're looking for food security. So you have multiple ways to search around. For me, I tend to go through select a category because I use AskCHIS a lot. I'm very familiar with it. And so I kind of know immediately, oh, this is the variable that I want, and this is the category that I want. But I think for others that are new to the AskCHIS platform, going to the search function would probably be your best one of your best bets and accessing the data that you want. Do keep in mind when we're doing compare topics that your topic of comparison has to have data for the year that you're focusing on and the topic. So if I'm looking at a variable that has 2022 data, and I want to use a compare topic that only went up to 2020, I'm not going to be able to generate that crosstab. They have to have concordant years. I'm going to look at food security real quick. I'm going to remove my compare topic. I'm going to get my data. Now we have this compare geography function. I can compare across counties. So essentially I can generate a table that shows me food security across all the counties. Now, if we were to change the geographic area to select all of these different regions, I'm just going to hit the checkbox on all the different regions that we have here. Going to get my data. It's going to show me pretty much, because I selected all the regions, it's going to show me an estimate for the state of California. Now, if I go to compare geography, I can say compare geographic areas. Now it's going to show me the estimate for each one of these regions selected. If I were to just do Northern Sierra counties, run my table, it's going to show me the estimate for the Northern Sierra counties region. If I go to the Los Angeles County service planning areas and select all of them, run my data, compare my geographic areas, it's going to show me estimates for each one of the different spas that are in Los Angeles. And this is likewise the same for the San Diego County Health Region. Run this table, compare my geography, compare geographic areas, and I get it for each one of the different health districts in San Diego County. And that is AskCHIS. This was just a real quick run through, real quick before we move on to AskCHIS Neighborhood Edition. You also have the option to, you have a library. So I could save this query. Sometimes I just call it tester one. Save it however you want to. Give it a name. So it could be, this is food security by. And so now if I close everything out, if I run just a new query altogether, even though I've erased that estimate table that I had, if I go back to my library, I can have it rerun food security by San Diego County Health and Human Services Agency district area. I see that there's a couple of questions in the Q&A and the chat box. When we get to the end, we'll discuss more. And one thing, usually with the Q&As, I tend to, any kind of like specific questions about AskCHIS and the different querying, when I get those, I can run through those to kind of show a little case scenarios for y'all. But now we're going to move on to AskCHIS Neighborhood Edition. Again, finding the link to AskCHIS Neighborhood Edition is in our quick links at the top of the CHPR website. I already have it open here. This is the landing page for AskCHIS Neighborhood Edition. One thing before we go on into this, I just want to let you all know, for AskCHIS, those are direct weighted estimates of the survey data. Now, AskCHIS Neighborhood Edition are modeled small area estimates. The reason why I go with modeled estimates is that for AskCHIS Neighborhood Edition, we are looking at smaller geographies than just the counties. We are looking at a county level, but also legislative districts, those being California Senate, California Assembly, and the congressional districts in California. Cities, zip code, and census tracts. Census tracts, especially in more urban areas, tend to be much, much smaller. And so we have to model those using data from different sources such as the Census American Community Survey and Claritas data. We do the modeling using small area estimation. Anyone that's interested in those methods, if you go into our health section, we have a whole list of the methodology as well as links to different research articles that we have pointing out kind of the methodology behind the magic behind creating these estimates. As if you have any real nuts and bolts methodological questions, please go to our help section, or you can email us at chis@ucla.edu, and we can give that to our statistical unit and get you answers. So like I said, this is looking at much smaller geographies than just counties. So these are modeled estimates. Because these are modeled estimates, you'll notice that our health topics here, these health topics are all derived from CHIS data, except our life expectancy. This is something that comes from the CDC. But all these asthma, community service, delay in receiving care, diabetes, et cetera, these are all modeled estimates from the CHIS. We also have environmental factors. These are from the EPA Cal EnviroScreen. Our sociodemographic section are all sociodemographic variables that we get from the Census American Community Survey, the ACS. And these are the 5-year estimates, the ACS 5-year estimates. We don't use the ACS 1-year, we use the ACS 5-year estimates. As well as we have different vulnerability indices. We have the Area Deprivation Index, Healthy Places Index. This pre-existing health vulnerability index was created using small area estimates from AskCHIS Neighborhood Edition, and it was created by the UCLA Center for Neighborhood Knowledge. And then we also have a social vulnerability index. So let's run a query on a health topic. We're going to look at mental health. I'm going to pull 2020. We are currently working on developing the 2022. As you see here, we go every 2 years. So we have 2012, 2014, 2016, 2018, and 2020. Our latest and greatest data that we have in AskCHIS Neighborhood Edition is 2020. We're currently working on the updates for the 2022 small area estimates, and we anticipate having them updated in the system by the summer of 2024. So if we go to mental health, 2020, you see here we have different indicators here. We have family life impairment during the past 12 months for those that are 18 and older, needed help for mental health problems, 18 and older, serious psychological distress, 18 and older, and work impairment, 18 and older. I'm going to select serious psychological distress. And now you'll see that a data table gets created. And we have an estimate for just the state of California. Now we're going to want to create some other estimates for different geographies. So I'll select the location button. I'll search the location. I'm just going to look up Los Angeles. I'm going to pull an estimate for Los Angeles County and the city of Los Angeles. I'll create my table. Now you see a map gets generated, and it's going to show estimates for cities, and it's a choropleth map. And it's not going to have the entire state in different colors because this is only looking at focusing on the geographic type of city. But if we go to county in the data table and I select that, now you'll see that we have a choropleth map that's created showing all of California and showing a different gradient of color for serious psychological distress. Now you notice some of the counties have some of the geographies have like this hash mark, which is which indicates that this one estimates are not available for populations below 1,000. So we suppress for any population. So Alpine County is a very small population. So any population that is under 1,000, we suppress that data. For statistical instability in AskCHIS Neighborhood Edition, we also suppress for unstable estimates, and we define an unstable estimate as an estimate that has a coefficient of variation that is greater than or equal to 30%. So you notice in the map, I can zoom in, zoom out by scrolling. I also have the zoom in, zoom out function here. If I hover over a geography, I get information in the tooltip. It tells me the name of the geography, what that estimate is, the 95% confidence interval, and the estimated population. I also have a histogram down here. It flags Los Angeles County because that was the county that I have in my data table, and it also flags where the state estimate is. You'll notice here on the side, I can filter out those areas that have estimates that are below my county, or I could say below the state level. So you do some filtering out with the histogram. Oops, still stuck on this. About that. Okay. Now you may want to download, export. You can export your data table. So with the data table here, we have a limitation with only 5 geographies. So I could add 2 more geographies on it. It won't allow for any more than 5 geographies. As far as the different topics or variables that you want in here, you can put as many as you want. You could have all the different serious psychological distress years. You could have other heart disease. You could have, if you want to put all the sociodemographics or whatever, you could throw them in here. For the purposes of this demonstration, I'm just going to stick with 1 or 2 indicators because it just makes it very hard to see because this data table will just get incredibly long. We also have an export functionality. So if you want to export this map, maybe you're just interested in serious psychological distress county-wise. Downloads a PNG file. You see here, this is what my download is. If you're looking at counties or legislative districts, for the most part, especially if it's like you're trying to compare all of California, I usually recommend using this button to kind of have it go to all of California because sometimes when the map gets generated, it's just going to kind of zoom in and focus on your area. So if I were to do an export right now based off of this, it's going to export the map based off the zoom. So I think it's up to you as the researcher to decide kind of what it is you want the map to be exported at. Other functions that we have, maybe you're looking at a Southern California region, and I'm just going to define Southern California region as San Diego County, Orange County, and Los Angeles County. You do have the ability to group geographies, combine locations together. And keep in mind that when you're combining geographies together, they have to be the same geographic type. So you can't say combine the city of San Diego with Los Angeles County. You can combine Los Angeles County with San Diego County. Um, you could do a combination of, and they don't have to even be they don't have to share boundaries. So if I wanted to combine San Francisco County with Los Angeles County, that's something that you can do here. But just keep in mind when combining the geographies, they have to be the same geographic type. There's no this one zip code combined with this congressional district or whatever. That's just not, it just won't jive that way. That's not how the system is set up. So anyways, I'm defining this region that I'm creating as a combination of Los Angeles, Orange County, and San Diego County. I'm going to add to my current selection. I'm going to create my table. And now you see here that it creates kind of essentially your custom polygon of these three combined counties, and then it generates an estimate based off of that combination. And again, with combining the locations, it doesn't have to be counties. You can do a combination of zip codes. You can do a combination of cities. You could do a combination of legislative districts, whether it's a state assembly combining one specific state assembly to another specific state assembly, or state senate district with another state senate district, or a congressional district with a congressional district. They just have to. The most important thing is, please remember, they have to be the same geographic type. We also have a find a legislative district functionality. This is based off of an address location. So it's going to geolocate the address. It's going to give you your state senate district, give you information on who that state senator is. You can add that to the table. Create your table. And now you'll see that we also have the core plus map showing core plus based off of the state senate district. And this would be the same as looking at your assembly district or your congressional district. Also, if you don't if you're not interested in kind of like finding a different location, but you want to see a chloropleth map of the different geographic types, if you notice here in the map legend where it says state senate districts, we have this little triangle. If you select on this, you could generate a chloropleth map based off of all the different geographic types that are supported in AskCHIS NE. So now if I run zip codes, it's going to generate a chloropleth map of all the zip codes. Likewise, if I look at census tracts, it's going to generate a chloropleth map of all the different census tracts. One thing to notice here is that the census tract naming nomenclature is just going off of Kern County tract 0052.01. So it's a little, sometimes getting to know your census tract, a lot of people, myself, I have no idea what my census tract is. Like, I don't know if I'm in LA County tract 500 or whatever. So for selecting your census tracts in the location, we have this field here, select the census tract. Before I do that, I'm just gonna remove some of these. Okay, I wanna remove the geographies. So we're gonna select our census tract. Now, with census tract selection, one thing that's really important is that you have to be using data that are supported with census tracts. For AskCHIS Neighborhood Edition, we did not start incorporating census tract estimates until 2016. So if you're looking at an indicator from 2012 or 2014 and that's it, this is going to be grayed out because you don't have data that's actually that's going to jive with census tract selection. So just keep that in mind. Data from 2016, 2018, and 2020, those are the years that have the census tract. So anything 2016 and beyond, you can do your census tract lookup. So I'm going to the select census tract tab. Going to load a map. By default, it just kind of goes to Los Angeles County on this map. It's just showing you all the different census tract boundaries that we have. And you'll see here that it's kind of telling you, hey, these are the different boundaries, et cetera, et cetera. So one thing we can do is we can do a address lookup on our census tract. So I'm going to throw in this address for Westwood. It's near the campus of UCLA. And one interesting thing about this one is you'll notice that it's kind of like right on the border. So you might if you're looking at an address that's kind of like right on the border of a two tracks, this is where it would kind of be incumbent on yourself, the researcher, to decide, okay, where am I going to put this pinpoint? I'm going to say it's this tract, or I'm going to say it's this other tract. So those are things to keep in mind. Usually, if it's dead center of the polygon, then I would say, then yeah, that's the right tract for it. But just stuff to keep in mind when you're selecting your different tracts. Where's the point location? So I'm just gonna stick with this Los Angeles County tract 2655.10. I'm going to select the add selected tracts individually. So I've selected that, but I know LA pretty well, and I know that there's a big difference, especially when you're looking at like smaller neighborhoods, which is essentially the census tracts are a way to kind of like use a proxy for smaller neighborhoods. Um, a lot of times, when you talk about like social determinants of health, and a lot of people say like place matters, where you live matters. And so knowing LA well enough, I know that kind of the west side, there's a little bit more affluence. I'm going to look at another area as well. I'm going to look at a tract in East Los Angeles, just so I can see if there's any differences between the two tracts that I select and serious psychological distress. Waiting for it to load. Sometimes it does take a little while when I do the zoom. I'm just going to create this table for now. I'm going to add that East Los Angeles tract. Well, it just does not like that address. Anyways, we'll just move on. So you see here we have a choropleth map of all the census tracts. By default, it's going to have a border that I believe is gold around your tract that you're looking at. Map has all the same functionality, so if you wanted to do the filtering out by the histogram, you can do that. I want to add asthma. Yeah, asthma is in the area by tract. And now you see in our table, we see kind of like a comparison showing what the state of California is for asthma, what Los Angeles County is for asthma, what the city of Los Angeles is for asthma, and also you can compare your tract that you're looking at for asthma. See, we have a bar graph here kind of showing the state line here, and seeing all of these geographies are below the state level, whereas this specific tract that we selected is above the state level. I'm going to go back into location selection and select census tract. And we also have the ability to combine tracts together. So I'm going to get rid of this LA County tract. I'm going to look at, let's go to the beach. I'm going to look at some of these Venice Beach areas. Maybe I just want to do, I'm just going to call these, I'm going to call these 4 tracts Venice Beach. They kind of cover most of Venice Beach. Actually, I'm going to get rid of this one because it kind of goes inland. I'm going to do these 3, and I'm just going to define them roughly as Venice Beach. I have the ability to combine those tracts. We also have a lasso tool here. So if you wanted to, maybe you were trying to do a wider swath. Maybe I want to do parts of Venice Beach and Mar Vista. If I use this lasso, essentially going to highlight everything that I lassoed. If I want to remove something from this combination, I just simply select on it and I get it removed. But for this, I just want to look at Venice Beach here. So I'm just going to do these 3 tracts that are on the beach. I have this option to combine selected tracts. It combines it together, and it's called Census Tract Group 1. I'm going to try to see if I can get that. Los Angeles. Okay, here it is. I'm going to combine these ones here. Just 3 tracts. I'm just going to say that East Los Angeles, and East LA is much bigger, but I'm just going to combine these 4 here. So Census Tract Group 1, it just automatically refers to it as a Census Tract Group. So Census Tract Group 1 is my Venice Beach tract combination, and Census Tract Group 2 is my East Los Angeles tract combination. I'm going to create my table. You see here, the map generates showing serious psychological distress, highlighting the Census Tract Group 2, the East Los Angeles. You see in the data table, I have my estimates. Let's throw in Hispanic or Latino, 18 years and older. So this can be very interesting as you go through. You can start seeing areas where you see the East Los Angeles tract group combination of tracts is 98% Hispanic Latino, whereas the Venice Beach tract combination is only about 11% Hispanic Latino. So throwing demographics in there can be very telling and help you kind of like unpack certain things with regards to social determinants of health and looking at the different health status of the area. And again, for this data table, you're limited to 5 geographies. Sometimes when I'm doing this, sometimes I might just remove California and just focus on if I'm doing like all census tracts. A lot of times what I like to do when I'm using this is I prefer looking at like a countywide estimate, a citywide estimate, and then looking at some tracts to kind of like get an idea of, okay, this is what the county is looking like, this is what the city is looking like, and now let's chisel it down even further to little neighborhoods. And with especially cities like Los Angeles, San Diego, San Francisco, Sacramento, you'll see in the map that the tracts are usually much, much smaller because they're just much, much more densely populated. But as you start zooming out and looking at more rural areas, you will see tracts are very, very large. So you see here in like near Big Bear, these are very, very large. Some of them, encompass close to a third or a quarter of the county. Um, Things that I've noticed as I've used this is if I'm looking around, like say the Salton Sea area, down in Imperial County, um, a lot of the tracts there, I think there's like less than 10 census tracts that make up that whole county. But sometimes for me, it makes more sense to actually look at the little cities. As you look at the cities, look up the cities around there, because you may find the city has a much um, smaller area that it comprises than the census tract. So those are things to keep in mind as you're working with census tracts for bigger cities like I said, Los Angeles, San Diego, San Francisco, Sacramento. A lot of times looking at like when you're focused on a neighborhood, it makes most sense to use census tracts with AskCHIS NE, but other times in the more rural areas, you may want to look at other types of geographic types, because the census tracts may not really capture, they may capture cast a much larger net than what you want. Okay, now I'm going to finish up with talking about our health profiles. Unfortunately, we don't have a quick links to our health profiles. So what you want to do is go to our work, select on California Health Interview Survey. And in this bar here, we have access CHIS data. And again, this is just another way to get to AskCHIS or AskCHIS NE, PUF, DAC, resources, but we have here health profile. I'm going to select access health profiles. We have two different types of health profiles dashboard. We have the adult health profiles dashboard and the race and ethnicity health profile. So let's look at the adult health profile. My dashboard generates. Essentially, this is just a quick and easy way to get health statistics on adults for your county, whether it's county, the regions, uh, Los Angeles County service planning areas, or the San Diego Health and Human Services. This data is done every 2 years, so these are direct estimates. 2011 to 2012, 2013, 2014, 2015, et cetera, all the way to 21, 22. So this is latest and greatest data that you can get. Demographic, it starts off, the landing page is demographic information. By default, it just goes to Alameda County. You can select by different geographic level. We'll just stay here, look at the counties, run it by Orange County. You have hover over information, displaying the geography, what the grouping is, what the estimate is, what the 95% confidence interval is, and footnotes about the data. Access and utilization, information on source of care, delay in getting medical care, type of insurance, health behaviors, current smoker. If you toggle by different years, you'll get more information, more variables. Kind of some of them get some of these variables were dropped, and that's why they're not available in 2022. Health outcomes, very poor health, diagnosed with diabetes, obese, diagnosed with asthma, serious psychological distress in the past year, diagnosed with high blood pressure, other factors, limited English proficiency, food insecurity, and notes on each one of the variables where they're footnoted. And then you have the option to download your report. You could download a PDF, or you could download just an Excel file. If you're going to download a PDF of your report, just select the download PDF. Create your PDF. Select the specific sheet from the workbook. Download. And you'll see that you get your PDF. And it shows you the different data that you downloaded. You also have the download data option. And this will download an Excel spreadsheet. And you get the estimates in Excel, letting you know what the variable name is, whether there's a footnote, your type of geography name, what the year was, what your estimate is, any flags for estimates being unstable, 95% confidence interval, and then also the comparison showing what the California estimate is. Race, ethnicity, health profiles, it's set up very similar to how the adult health profiles are set up. You have race ethnic groups. So you have Latino, and then you have a breakdown by the different Latino ethnic subgroups: Mexican, Central American, South American, other Latino, African American, non-Hispanic, white non-Hispanic, Asian non-Hispanic, and that broken down by the different Asian ethnic subgroups: Chinese, Filipino, Japanese, Korean, Vietnamese, South Asian, other Asian, and then other two or more non-Hispanic Latino. And it goes the same way, pretty much set up very similar to the adult health profiles. Downloading the report is the exact same. I'm not going to walk through that. Yes. So that concludes our demonstrations of AskCHIS, AskCHIS Neighborhood Edition, and our CHIS health profiles. Now I'm going to stop my screen share and we can go on to our Q&A, Tiffany.
Thank you so much, Jacob. So for folks who haven't asked their questions yet, go ahead into the Q&A and get them up there. We've got about, 8 to go through. So let's get started. Do CHIS, AskCHIS, and AskCHIS any use different usernames and passwords?
Logging into AskCHIS is the exact same way as logging into AskCHIS Neighborhood Edition. Once you create your login, and you know what, I'm going to share my screen just to walk you all through that. So let's go to quick link. Let's go to AskCHIS. Okay, I'm just going to sign out real quick. So I signed out. So if I create my account, this is where I'm going to go to create my account, to put some information, all that good stuff. I know this is something that we do almost on a daily basis now, where we have to create a new account. This account that you create here, whether you do the create account in AskCHIS or the create account in AskCHIS Neighborhood Edition, this username and password is the exact same. There's no, you don't have to create a special password for AskCHIS and versus AskCHIS any. So it's just the same one. I highly recommend to have your browser save your password. I don't know about you all, but I have way too many passwords in my in my life, and it's very, very important. And if you encounter any issues with logging in, by all means, email us at chis@ucla.edu. We'll get with our IT team and make sure that we get you logged in. We want you all to accessing this information.
Thank you.
Yep.
Does AskCHIS have all the variables available in the survey or a subset of the variables?
It's a subset. There are some variables just based off of some of it is because of sample size. There are questions where it kind of they get chiseled down, they get based off of certain responses. And some of them, the layout for AskCHIS, it's just some variables they don't jive well with how AskCHIS is set up. So it is a subset of variables. It's very robust. I think this for the 2022 data release, I think we had close I want to say close to, we had over 300 variables. So we do have a lot of the questions, the main core questions, like all the general health status questions, the COVID-19 questions that we've been asking since 2020. So there are a lot, but if you go through the our resources section, back to CHPR website, our work, CHIS, California Health Interview Survey, access CHIS data. So in the resources section, you have data dictionaries, etc. So you can access the CHIS survey instrument, the data dictionary. If there's anything in there that you don't see as an AskCHIS, by all means, email us, UCLA, chis@ucla.edu, and we can work on getting those. We can consider those for addition.
Thank you. Can you please do an example of a weighted analysis here? I think that question was regarding AskCHIS.
Yeah, so with AskCHIS, everything that I was running, those are all weighted analysis. There's no option to do an unweighted analysis. It's all using the survey weights. Kind of just a quick peek into the back end of the mechanics of AskCHIS. So essentially, we have a SAS server, and we have all these SAS data files, and we have the weights in there. And as you're going through kind of using AskCHIS as kind of like, think of AskCHIS as a graphic user interface. You're pointing and clicking, you're saying, okay, I want to look at the state of California. I want to look at obesity, adults, 18 and older, or whatever. It's getting sent in the back end to a SAS server, and the SAS is taking the survey data from the SAS files that we have in the server and running that and doing it kind of like essentially analyzing the data on the fly to give you those estimates. So everything that you saw that I was doing with AskCHIS, those are all weighted estimates. Anything that you do in AskCHIS is going to be a weighted estimate.
Thank you. This person asks, when I'm looking at the compare function, I'm used to seeing percentage horizontal versus vertical, i.e. as a proportion of the total row versus column. Here, I only see 1%, which is it? Okay. And that was AskCHIS.
That was AskCHIS. Let's do a compare. Graphic. I'm going to do this by gender. Okay. So here we're seeing that 53% of males in 2022 were able to afford enough food, whereas 58% of females are able to afford enough food. So this is essentially showing. Okay, could you reread that to me? Sometimes I have a hard time conceptualizing.
Yeah, of course. When I'm looking at the compare function, I'm used to seeing percentage horizontal versus vertical. That is as a proportion of the total row versus column. Here, I only see 1%. Which is it?
Total row. So this is the percentage of the column.
I think if I'm not mistaken, is it that compare geography drop down? Oh, no.
No. So if you wanted to flip it, so if you want to see able to afford enough food, so those that are food secure, if you flip, if I when I transposed it, it's essentially saying that 41% of males are food secure versus 58% of females are food secure. When I transpose, if I just go back to the original layout, it's 53% of males are food secure, whereas 47% are not food secure. So it's a little confusing. If you want that question, whoever sent it, please send an email to CHIS@ucla.edu. We can have one of our statisticians give a much more comprehensive description of what we get in AskCHIS versus what you're describing.
Thanks, Jacob. Will more genders be added to CHIS in the future?
So we do have in gender. So if we go to demographic, we have sexual orientation and gender identity. And so gender identity right now, we have not transgender versus transgender or gender non-conforming. I know that this is a very, this is a very important topic. I know that I think we're having a work group look at these SOGI, what is that? Sexual orientation, gender identity. So I think for now, I do understand it. I think one thing, if you look at the data, it is very, like we even have here, we have this pooling multiple years strongly recommended. We are starting to see, I noticed from 2021 and 2022, we are starting to see a bigger increase in those respondents reporting being transgender or gender non-conforming. But if you look at years from like 2015 to about 2019, sample is very, very small. And so you do have to pool. So I think that that's stuff to consider with any one of these variables, especially when you're talking about smaller populations. We want to have those in here, but I think one of the conundrums is it's a smaller population. They're in the margin, but there may be issues with instability. So for now, we do have this gender identity, and you can do things with that to essentially create a cross tab, because I know it's just not transgender, and some researcher will be like, well, I want to look at specifically, trans women versus trans men, etc. So there are some things that we can do with AskCHIS to work into that, and I think in the future we're looking and we're trying to figure out other ways to really address the SOGI.
Definitely. And as Jacob mentioned, we do have a CHIS sexual orientation and gender identity working group, and they are meeting regularly. They did do earlier this year, I believe, a cognitive pretest report on sexual orientation and gender identity. You can find that likely on our website. If the person who asked the question wouldn't mind emailing me, it's tlopes@ucla.edu. I can get you a copy of that report as well. Okay, next question. Is there any way to use Boolean logic when constructing a group, or is it just the built-in questions we have when generating a query?
It's going to be the built-in logic. There's no extra functionality to that. I think something like that is most likely, when I hear that question, I'm thinking in my head, you're going to possibly want to look into a DAC project. So a DAC project is essentially kind of looking further. It's we have just a real quick precursor overview. We have these public use files. So these are files that you can access for free. These are SAS files for the survey data, but they're going to have certain variables that are kind of considered sensitive, that are not going to be included in it. So you're not going to get any information on like the different county strata that we have, any kind of like geographic location. Essentially, it's going to be just a file for the state of California. And so you may, I think something like that, you might want to look into like running the puff. But if it's kind of like you're looking at specifics, like with regard to, I think I'm pretty sure gender identity is not in the PUF. If you're looking at those areas or like specific geographies, then you'd want to go to the DAC, read more and just go through here, read more about the DAC, and it might be something where you have to submit a DAC project to have to work with our statisticians on getting you those estimates.
Thank you. And I just dropped the link for the public use files in the chat. Their contact information is there as well. So definitely reach out to them. We had a couple questions about Asian subgroups and what is available for other Asian or other Pacific Islander. Somebody says, are we able to generate data for specific Asian groups such as Southeast Asian or Cambodian, or specific PI groups such as Tongan, Samoan, Palauan?
Good question. So if we go in here, if we select a topic, we go to demographic, race, ethnicity. We have these Asian ethnicity groups. And here our options are Chinese, Japanese, Korean, Filipino, South Asian, Vietnamese, other Asian 2+ types. And so this might hit some of your some of what was mentioned. It's not showing Cambodian. As far as Native Hawaiian Pacific Islander, we don't have any breakdown beyond. One thing I do recommend, because you'll notice as you go into AskCHIS, if you do a compare by and you do the race OMB, you're going to get a lot of instability with the NHPI. And part of it just has to do with sample. One thing that I recommend doing is we have these any mentions of. So here we have like any mention of Pacific Islander. So you may have and I think especially in Pacific Islanders, like you have some folks that are they may have they might also be Asian. They might be like Japanese and an HPI. And so part of that with regards to where they fit in the racial group is kind of like how they identify. They might say, yeah, I'm Hawaiian, but I identify as this. So I recommend also exploring the any mention, whether it's any mention Pacific Islander, we have Black African American, Vietnamese, Chinese, Korean, Filipino, any mention of Asian, any mention of being white, Japanese. We also have a MENA, Middle East and North Africa origin. So I would recommend looking into those. But as far as being able to break down NHPI by the subgroups, we do not have that.
There are a couple of other questions on Asian subgroups and subethnic groups in the chat. So the first, is it true that Asian subgroups used to be available in the public use files, but no longer available now?
I do not have the answer to that.
Okay. You can, if you want to email chis@ucla.edu, we will get an answer to that. And then are there plans to incorporate some of the other sub-ethnic groups, such as Cambodia and Lao, as well as Tongan?
I do not know. I think that's a good email to send to us at chis@ucla.edu.
Thank you. This person asks, does AskCHIS any adjust for assembly district geography changing with redistricting as of June 2022?
That's a great question. So we will be making those for our updates for the 2022 small area estimates. All of those geographies that have changed every 10 years, we get the census tracts get realigned. The congressional districts, state Senate districts, state assembly districts, those get realigned. Some boundaries change for zip codes and boundaries change for cities. When we do the updates for 2022, those will all be taking into account the new boundaries that have come out. So yeah, but for right now, when you look at the 2020 data, those are the old the old boundaries that from the previous decade.
Thank you. And I'll drop a link in the chat if you'd like to register to receive our emails, and we will be sending out that AskCHIS information via email blast when we do launch. We have a few more questions, so if folks have questions, definitely drop them in the chat or the Q&A. While you're on AskCHIS still, is every variable in the data set searchable in AskCHIS or just some major topic areas? So when you do an actual search, is it based on category versus question?
So for the search topic, it's based off of kind of what the question is, as well as we have we throw in keywords in there. So if we were like, say, if I just type COVID, I'm going to get a lot of, and part of it is doing it based off of what the question is. But it's also based off of keyword search.
Thank you. Have you considered looking at involvement with the criminal justice system as a demographic? So incarcerated, yes, no, never, juvenile, etc.
So we do have, go to select category. We have encounters with law enforcement. So number of times stopped by police, ever been arrested, booked, etc. Some of those examples, they're not asked in the CHIS, so we don't have those included, but those are very important things to consider. So I think, you know, I highly recommend going through the survey instrument, and folks, anything that you see that like this would be an important thing, an important question to have, important addition to the CHIS, feel free to email us at chis@ucla.edu.
I'm a little confused by this question, so we might need some clarification, but what did you mean by updating the data, considering you collect the data every 2 years? I'm not sure if this is about AskCHIS because with AskCHIS we do collect every year.
Yeah, so if it's with AskCHIS Neighborhood Edition, the thing with that is like we have to do so we've collected the 2022 data, we've released the 2022 CHIS data. The 2022 data is in AskCHIS, but in AskCHIS Neighborhood Edition, there's a process with regards to developing the models, massaging the data, a lot of extra work that takes 6-7 months to do. So those updates to AskCHIS Neighborhood Edition are not done. We're currently in the process of creating the model estimates for AskCHIS Neighborhood Edition.
Yep. And then we have a question on the public use files. Is it permissible to analyze and publish data from the public use files? If it is not permissible to analyze and publish the data, what would be the process to obtain permission for analysis and publication?
That's a question to ask to our DAC team. I'm pretty sure it is, but I'm not 100. I don't know the logistics around that. So if you can email chis@ucla.edu, they can give you the scope of the permissibility and proper citation, etc.
Thank you. I think those are all the questions that we have. I'm going to again drop a link in the chat for the survey. If you could please fill out that survey so we can continue to improve on our training sessions, though Jacob always does a great job, of course.
Oh, you flatter me.
And then I'm also going to drop in the chat a link to our trainings site. You can access AskCHIS and other trainings, AskCHIS NE on that site. There's video trainings as well as PDFs. And here is a link to training. And if there are no further questions, I think that we can close this session. Thank you so much to everyone for attending. It's been a pleasure as always, and hopefully we'll see you soon.
Yes, take care, everyone. Appreciate your time.
Thanks.